Hi everyone, I am Dr. Dhabaleswar Sahoo, Senior Consultant in Cardiology, Prathima Hospital, Kachiguda. Always structural, maybe functional, and it is meant to decrease output or decrease in stiffness to filling. It is not necessary heart failure means low LVF. Okay, it is a universal definition, recent definition, and it is correlated with your biomarkers like natriuretic peptides and other evidence of pulmonary or systemic congestion. This is the basic. So heart failure is not a disease of heart; it is a clinical syndrome. It affects each and every part of the body. Okay? So why you are discussing about the heart failure, all the heart diseases? Because if you will see, according to JAG 2024, 64 million people are having heart failure worldwide. And in India, if you will see, it is heart failure rate is increasing because of the treatment, all the year. So the people's life is increasing. That's why the incidence of heart failure is increasing. And India is the diabetes capital of world. So India is going to be the capital of heart failure also because of rheumatic heart disease, obesity. About 1.3 million to 4 million people are having heart failure. Some studies show it is 10 million. So 1% of adult population, it is approximately 1% of adult population having heart failure. So over for 65 years, it is a leading cause of hospitalization. If you will see, in India, 1/3 of population of heart failure getting readmitted in the hospital. Means heart failure, 1/3 patient. One of every 3 patients readmitted to hospital at least once in a year. And about 5% people, they are admitted repeatedly. So it is burden to the society and burden to the patients also. And 1/3 patients died within 1 year of diagnosis during their productive life. So the heart failure is a grave situation, and I will highlight what is the basic concept, okay, and I will highlight the mechanism. Unless otherwise you will know the disease process, how it affects, you cannot develop the recent advances. So basic understanding of heart failure is also important. Okay, so what is the etiology of heart failure? It is not a cardiac etiology only. It is due to myocardial diseases, also disease to rate and rhythm, and pulmonary diseases also can cause heart failure. And metabolic diseases, thyrotoxicity, nutritional disorders, so they can affect the heart failure. It is not only disease of heart. So all the non-ischemic causes like genetic disorders, your patients are taking chemotherapy also then can affect heart. Some infections also affecting heart. So all the valvular diseases also affect the heart, leading to heart failure. Okay, all the signs and symptoms. Just refresh up the knowledge. What the symptoms? The symptoms is dyspnea. Dyspnea. Then there is paroxysmal axillary dyspnea, orthopnea. These are the symptoms. If you will see the patient will grossly having gross swelling. If you will examine the patient, you will find the pedal edema, then crepitation, rales, S3, S4 sound. These are the common features So the Farmington diagnosis criteria, 2 major criteria, 1 minor. These are clinical criteria, just basics. Modify framing criteria. These are criteria, I am showing the criteria because these are the important things to rule out the dyspnea from heart failure and due to other causes. Okay? So, lot of terms are there in heart failure. You will find that systolic heart failure, diastolic heart failure, left heart failure, right heart failure, congestive heart failure. These are the terms you will find everywhere. High output, low output, acute, chronic. So, what happens now? The guidelines, age guidelines says, before proceeding treating heart failure, you have to classify which stage you are treating, which patient you are treating. You have to have a clear guidelines in your mind. Okay? It's not that heart failure you give diuretics, whatever the medicine. First you have to diagnose the disease, then you have to analyze which patients should need advanced treatment also. So stages of heart failure, the stage C is called symptomatic heart failure. Just like hypertension, there is now a concept coming pre-heart failure. Just like pre-hypertension, it is pre-heart failure. Pre-heart failure means those are not having symptoms and signs of heart failure. Suppose sometimes CAD patients, they don't have heart failure symptoms. But if there is a structural functional abnormality, and if there is a risk factor, sometimes you're finding the patients having a prolonged increase BNP and troponin markers, but you are unable to think whether it is what are the causes. If you will not find the causes of CKD, all the things, that is also comes a pre-stage heart failure. Okay? Then new concept is coming, stage A heart failure. Means this heart failure, there is no sign and symptoms heart failure, no structural functional diseases, but patient with diabetes, multiple risk factor, you will also treat as a pre-stage heart failure, means stage A. And the stage D is, that is decompensated heart failure. This is called your advanced heart failure. So depending on the stage, you have to strategize the patient. Which patients you need to give advanced treatment, which patients you will give basic treatment. Okay? This is the repetition of the slide. Then you have to classify LVF. What is now there is a classification of depending on the LVEF, LV ejection fraction. Just remember, if less than 40%, it is called heart failure with reduced ejection fraction. If more than or equal 50%, it is called preserved ejection fraction. And if it is 41 to 49%, it is called mild reduced ejection fraction. Because it is classified because the treatment depends upon the LVEF. Okay? And another things are coming, that is called improved ejection fraction. Suppose patients you treated, it is 40%, and the treatment is improved to more than 40. Okay? It is called improved ejection fraction. So, if you are treating improvement fraction, don't stop the medication. You have to continue the medication. Okay? So, these are stages and the classification, and is the trajectory classification. These are recent advances. You will see new onset, then resolution symptoms, persistent symptoms, worsening symptoms. At which stage heart failure we are seeing the patients? Pathophysiology. With basic pathophysiology, you have to understand the disease. Because heart failure, just like a fever, because it has multiple causes. Okay? So simple like viral fever, then you will like to malignancy also. Heart failure is also like that only. Suppose heart failure, what will happen if there is index events? Suppose infection or heart attack, what will happen? There will be decreased LVF. And there will be activation of the compensatory mechanism. We will see the compensatory mechanism. There will be activate. Okay? So, what will happen? There is hypertension, body will stimulate that, decrease blood pressure. So, compensatory mechanism will come account. There will be activation of sinus, sympathetic nervous system. Okay? Then you will activate the RAS, the sympathetic nervous system. That what will happen? It will try to increase the blood pressure. By increasing sympathetic nervous system activity, so it increases the blood pressure, increases the RAS, renin, angiotensin, aldosterone axis. Okay? So by that way, it will maintain and the patient becomes asymptomatic. Okay? But if the events will continuing, so what will happen? If the event will continue, there occurs secondary damage. Okay? Secondary damage means there occurs LV remodeling, decreased LV contractility, hypertrophy, hypothesis, and progressive heart failure. So the mineral antagonist will act aldosterone, the ARBs, AC inhibitor, they are different pathway. Now the neprilysin inhibitors, sacubitril and neprilysin inhibitor, all the paradigm of trials shows that it decreases this mortality, increases survival. You will see the angiotensin blockers, what happens, while the RAS stimulation also, that will stimulate the neuropeptide system. Because see, anything happens, there will two interaction in body. One good thing will happen, one bad stimulus, the chemicals will release. Good chemicals, bad chemicals. The treatment is, you have to decrease the bad chemical secretion, you have to increase the good chemicals. Here the good chemicals are nitropeptides. Okay, each causes decreases sympathetic vascular resistance, decreases sympathetic tone, decreases aldosterone, just reverse with the RAS. The neprilysin, it degrades the nitropeptides. So you have to give neprilysin inhibitor so that this good functions, the relaxation, the sympathetic tone, that improves. And you have to simultaneously block the angiotensin receptor by valsartan. That is the new concept. You will see drug overall. There are different set of drugs. That is called neurohumoral modulation, beta blockers, this mineral receptor antagonist, the RNA AC inhibitor, ARBs, and SLG2 inhibitors. Okay? The SLG inhibitors are cardio-nephrometabolic. And these upper drugs, they improve the survival. So now, the 4 drugs are now the 4 pillar of heart failure treatment. Okay? And if you see the lower ones, these are the sign evaporating, omecamtiv, digitalis, vericigat, diuretics, and ferric carbonate. This reduces the hospitalization, heart failure hospitalization. Okay, now SCGL inhibitor is emerging. Although it is for purpose of glycogen, for diabetes, but in the heart failure, it cures beyond diabetics. Okay, now it is indicated. Previously, it was given in reduced ejection fraction. Now, irrespective of ejection fraction, you have to give SLG inhibitors, EMPA and DAPA. Okay? So, if you will see how it affects the heart failure, because it is a diabetic drug. How it happens? Because while SL2 inhibition, it has a diuretic effect, so it causes nitrosis, it removes the sodium. So, fluid automatically will go. And it has metabolic effects also, increased glucagon and sometimes increase tone. If you see, it reverses all the things, the sympathetic nervous system, the aldosterone, the renin, the nitropeptides. So it reverses each and every steps of heart failure. So SLG2 inhibitors should be used irrespective of ejection fraction in heart failure patients. Now this vericigat. Because unless otherwise you understand the mechanism of heart failure, you cannot develop a drug. Vericigat is a SCC granular cyclase synthetizer, because see, the cyclase GMP causes vasodilation. Okay? But heart failure due to endothelial dysfunction, this SCG, there is insufficiency. What vericigat? It directly stimulates. So it causes vasodilation. Then omecamtiv, it is a myosin, cardiac myosin activator, because the heart contraction occurs when there is actin myosin complex. So another is anemia and heart failure. Okay. Now its guidelines says also, if there is hemoglobin, that is also guidelines. You will see hemoglobin is less than 15, if the ferritin is 100, less than 100, you have to correct iron. You have to give this injectable iron. It is just a diagnostic algorithm for reduced ejection fraction, how will treat, and I just highlights how will treat the pre-stage, stage A and stage B heart failures. You have to treat stage A means there is a risk factor. You have to control the blood pressure, you have diabetes, you have to give this glitazones, and if you will stage B, you have to give AC inhibitor, beta blockers, and if it LVF 30%, you have to give ICD. So earlier 2013, these are the 3 pillars. Now I have 4 pillars: RNA, beta blockers, MRA, and SL2 inhibitors. And Fabulous 5 is vericigat. You know, vericigat is a vasodilator, and Flight 6 intervention iron. There is a guidelines, it will discuss later. So some of it is a medical treatment, and recent advance also, if there is a LV dysfunction, CRT also, CRTD will be given, and surgical intervention, it will discuss later detailsly. And if you will see, heart failure is pre-ejection fraction. SLG2 is a class 2 indication.
See, I am going to tell about few things about heart failure. Heart failure affects 60 million of people worldwide. The prevalence of heart failure. And in India, it is 1.2 million to 6 million. Because of India is the diabetes capital of world. Now, because of hypertension, lifestyle changes, and the CAD, it is going to capital of heart failure also. So, treat the heart failure before it becomes symptom. Control your blood pressure, control your diabetes, change your lifestyle, stop smoking, and stop junk foods, and move on life. Thank you.